As you can see, the title for today's webinar is Employer's Guide for CalOSHA Compliance in a COVID-19 World. I don't know if you are familiar with the word CalOSHA, but today's presentation, I will do all my best to familiarize you with the role of CalOSHA. Cal stands for California. OSHA is Occupational Safety and Health Administration, which I'm going to explain shortly later. It's very important to know the role of CalOSHA in these pandemic times because they have a role to play, not only a simple role, but a major role. Throughout the pandemic, all of us, what we did, we were so focused with the role of CDC, of the Department of Public Health, Department of Health and Human Services. But this time around, I would like to familiarize you with the role of CalOSHA, which is very important in a workplace environment. Hold on. Oh, Kami did not work again. Let me... Okay. I don't know if I've already introduced myself. Again, let me introduce myself. My name is Joey Tugong. I'm your consultant on risk management. And so my role is to provide consultancy in all key areas such as labor or anything that pertains to human resource, including work-related injury or any type of liability or exposures on the part of your company. As is the case, every time I conduct a webinar, what I do, I provide data regarding the COVID because it's very important for all of us to know what is happening around the world and also in the state of the nation and in the particular state we reside and also the particular county where we work, meaning your workplace. That's very important because I'm sure you're familiar with the word community acquired. So if for some reasons you end up with COVID-19, then you have to, as an employer, you have to find out what is the community spread in your particular area. Perhaps the employee might have been infected with COVID-19 as a result of community acquired. Oh, yeah. Oh, what is that interruption, Roland? Okay. So it's already off. And so this will just show to you as of today or yesterday, last night. So global, we stand now at 22 million COVID cases with 797,000 deaths, which explains why there are no travel for the last few months. No one is allowed, if they do, but there are strict quarantine measures that are being undertaken. Not unless there is a vaccine or antiviral drugs, for that matter, the world, there will be no travel at that juncture. So in United States, we have 5.7 million confirmed cases. That's 177,424. And so United States, in terms of confirmed cases and deaths, we are number one in the world, followed by Brazil, then India, Russia, and Mexico. These are the top 5 countries in the world with the highest number of confirmed cases and including deaths. In California, where we are situated, we are number one in the state of the nation. There are 50 states in the nation, and that is our confirmed cases. 653,264. That's 11,821. And, of course, counting. As the day goes on, there are always confirmed cases because as we go through the process of the rapid testing and the antibody testing or all types of testing that we have, there will be confirmed cases. So it goes every day. So in Los Angeles, we have 227,346 and that's 5,446,000. So we are number one in California, okay, the county of Los Angeles, followed by Riverside County. So you are situated in Los Angeles County. That is your community numbers, 227,000. So in other words, there is always a chance that if you're going to um, go to places in and around Los Angeles County, there is a possibility that you'll get infected by the COVID-19. So you have to take extra steps, extra measures in order to, to protect yourselves from getting infected. Because if you get infected, there are two things that would happen. Family members or one of your household will get the COVID-19. And if you go to your workplace, either Los Palos or Secres, then you could serve as a carrier. Again, let me repeat. In my last presentation, I said that our residents most likely will not be the one who is going to transmit the COVID-19. Not unless as a result of new admission or readmission, or perhaps they are on a dialysis that potentially they could have the COVID-19. But what we normally do, we cohort them. So in the general scheme of things, therefore, it is us, the employees, that would cause the transmission. So we better be very careful every time we are outside of the facility. You always remember essentials and non-essentials. If there are things that you consider are non-essentials, please do not go out of your house. But if it's essential, of course, you need to buy groceries or all of these things that you need that would sustain and support your household, then you could do so. Now, since we have also a client in Tennessee, so these are the confirmed cases. 139,175. That's 1,488. They are number 11 in the state of the nation out of 50. More or less, this is still high. And so, since the facility is located in Davidson County, you see the confirmed cases? 24,840. That's 242. Out of the 5 counties in Tennessee, Davidson ranks number 2. Number 1 is Shelby County. So, our employees in Tennessee, be very careful because the community spread in your county is high. Okay, let's move forward. For us to have a better understanding of my presentation today, we need to differentiate the two following agencies. I'm sure you're familiar with the Department of Public Health, which is the one that has a primary role in regulating the industry that we are into, which is into long-term care or skilled nursing facility. And the role of the Department of Public Health is not to look into the workers as employees. Their primary role is to look into the residents' welfare, health, general, and their interests, to protect their interests. And which stands to reason why we have the local ombudsman. Okay? They are the advocates for the residents. And the DPH is also there. All of these licensing surveys that you have, annual and complaint investigation, including the focus surveys that you have nowadays, that is geared towards infection control, it's not about you, it's about the residents and the patients. So what is the agency, therefore, that deals with the safety, the health, and the protection of the employees? My friends, ladies and gentlemen, that is what we mean the role of the Occupational Safety and Health Administration. So their focus are only the workers. So this presentation only pertains to employees, meaning you. So what are the guidance? What are the regulations? What are the interim enforcement that OSHA has rolled out in order to protect the employees? So this is the reason why I'm presenting this. And it is very important for the employer and you as department heads or managers or supervisors, since you represent the employers. Remember, you are agents of your employer. You don't belong to the rank and file. So you must know exactly and precisely what is your role as it relates to our employees in relation to or in the context of the COVID-19. How are we going to protect them? What are the regulations, interim regulations as well, that would oblige, that would mandate, that would compel employers to protect the employees from getting the COVID-19? And if they get the COVID-19, what are their rights? Employers, what are you supposed to do? Are there certain programs or policies and procedures that you need to have in place in order to protect our employees. So my friends, ladies and gentlemen, that is the role of OSHA. So for now, forget the Department of Public Health because this pertains only to OSHA as it relates to our workers. Now, this is just a periscope to give you an idea. Every day, since the first week of March, all the newspapers, the tri-media, when I say tri-media, radio, television, and the social media, the print, you will read, you will encounter, you will hear, you will see in all of this news the role of Occupational Safety and Health Administration. There are a lot of complaints filed by employees that their employers has not protected them, has not ensured their safety in the workplace as a result of the pandemic. That they were compelled to go to work without giving them any PPEs, without training them on how to use the PPEs. Not only with regards to PPEs, but in general, not mindful of the safety and health of the employees. And so if these employees felt and they perceive and they have seen or that they have been subjected by their employer of exposing them to these hazards, and when I say hazards, this pertains to the COVID. It's an infectious disease. Then they have the right to file a complaint with OSHA. And OSHA, in effect, therefore, when they get these complaints in behalf of those workers, then they are going to conduct an investigation. So you're going to receive a love letter. Okay? And not only a love letter, perhaps, without informing us, they will just drop by in your building and they will just show their ID badge that they are certified health and safety inspectors or enforcement officers of OSHA. And they're going to ask you a lot of questions. And if you cannot provide the answer or the documents that they have requested, then you end up with a citation or a penalty, a civil monetary penalty. And it could be 5,000, 10,000. More so if there is death by one of our workers as a result of the COVID. Or perhaps a serious injury or illness by one of our employees as a result of exposure from the COVID. Even without a complaint in that regard, if there is death, serious illness by an employee as a result of the COVID in the course of their employment, no need for them to file a complaint by their family members or by the employee. If they will find out, they will go to your building, I'll tell you, very serious penalty. You will end up with civil monetary penalty. So therefore, my friends, it is very important, therefore, as a result of the pandemic, this infectious disease, we will always expect and we should anticipate that some of our employees, this is the key, if you neglect them, knowing that they're already COVID positive, and then you're not going to reach out to them and provide the necessary assistances, I'll tell you, they have the right. Why? Because in our state and federal labor posters that we post in our conspicuous places in the building, there is a requirement regarding OSHA. And there is a 1-800 number. So they can call. Don't you know that they can call anytime? And they can even call anonymously. They don't have to identify themselves. So you have to be very careful. And not only that, if you knew, if one or two of your employees called CalOSHA or OSHA, the federal OSHA, do not call them and investigate them because that is an act of retaliation. Why? Because that is their legitimate right to file a complaint. So what you do, if you knew, then immediately call in and then request for a meeting and look into his or her concerns. Okay? So it's all over the newspapers. Every day you read it, that there are a lot of complaints, especially those who are involved in highly critical infrastructure. Our essential workers, okay, in the healthcare industry. We call them the frontline health workers. This is now the focus of OSHA. So, employers, all of you, you better be prepared and this presentation will help you. Now, the role of OSHA the formation of OSHA, it was organized in 1970. There is such thing as the Occupational Safety and Health Administration Act of 1970. And their primary role is to see to it that all employers must protect the safety and health of their employees from any forms of hazards. Hazards that would cause either death or serious injury or illness. You see, that is the role. One and only role. And so, it is therefore incumbent on us as employers and you as managers, as supervisors, that we should ensure a healthy and safe environment for our employees. Not only in pandemic times and even prior to the pandemic times. That's why we have a safety program in the building. The purpose of the safety program is to ensure the safety of our employees. Because we want our employees not only safety, because the byproduct of safety is having a productive workplace. When we are productive, then it generates an environment where everyone are not stressed, where everyone can contribute to the maximum and excel, and not only that, harness their potentials. So what is the coverage then of this law or the role of OSHA? Almost all private sector companies in the country, always remember, private sector. Of course, we are in the private sector industry, right? And so, definitely, they will subject us to the OSHA regulations. But are there certain exceptions? The answer is yes. And you can see here, these are the exceptions. Meaning OSHA does not have regulatory arm, okay, towards all of these particular entities. But it does not mean that these entities does not have to observe or ensure the safety of their employees. No, because there is a particular law also, either state or federal, that would regulate these particular entities. What it only means is that federal OSHA and state OSHA does not have a role in this particular entities because there is already an existing law that governs these particular entities. Okay? Now, so what is the role therefore, of the employer? Clear. We have to ensure the safe working conditions of our employees. And in order for them to get injured in the workplace, of course, we have to provide them the proper or necessary safety tools and equipment. And we have to warn employees of potential hazards that we are duty bound. And then we have also to provide safety training. And of course, lastly, which I've already discussed this briefly with you earlier, never discriminate to employees who exercise rights under OSHA. So we cannot just tell employees, hey, employees, you are hired, you have to observe safety in the workplace. No, you cannot just easily do that. There is such thing as safety orientation. And if the job requires the use of any tools that would ensure the safety of the employees, e.g., the PPEs, especially those working in housekeeping and in maintenance, where they need to wear perhaps goggles or perhaps an earmuff because as a result of certain devices that would more or less cause a high decibel tone of the machine, it will cause injury to their ears, or perhaps a grinding tool in the machine shop. Now, they will have to wear goggles. And then of course, we conduct hazard assessment and hazard evaluation as part of our safety program. Then, as a result of our hazard identification, then we can already, in advance, inform our employees these particular chemicals, these particular solutions, or this particular area in the hallways and corridors. You put caution cones, you put yellow tapes. That is already warning employees, right? So, that is necessary. With your residents, we have to provide safety training to our employees, proper body mechanics, and how to lift, how to push, how to pull. residence. If it requires two-man transfer, if it requires under your care plan that there should be a Hoyer lift or mechanical lift device, well then they have to be trained and they have to be informed. So all of these are just examples of the employer responsibilities. Otherwise, if we don't have this in place, then you end up with a citation or a deficiency. And worse, your business will be closed for a certain period of time if there will be death in the course of, of employment. And remember this, when there is death or there is serious injury or illness that arose out of employment, we cannot keep our mouth shut. We cannot hide because we have the obligation to call CalOSHA that there was death, that there was serious injury or illness to an employee within 8 hours. If you go beyond 8 hours, you will be in trouble. I should know because I have already been in this situation, not only in the past but in the recent past. But I will discuss that later. So, to put it in the proper context, regarding COVID-19. So, around March, when COVID-19, the COVID pandemic, World Health Organization declared a world emergency because of the COVID-19. And even in the United States, around March, when the president issued a national emergency in the state of the nation. So, federal OSHA. When I say, you see the word Fed, meaning that's the federal OSHA. I'll explain to you later also what is the state OSHA. So they immediately also came up with their own guidance in order to protect our employees. So there is a timeline that I would like to share with you. So around early March, remember, a guidance, well, it is just a guide, but this has the force and effect of a law. Always remember that. If it comes from an agency, well, it is just a guidance, and yet I would say it has the force and effect of the law. So meaning, if we fail to follow this guidance, then we end up with a citation or a deficiency. So they came out with a guidance, FedOSHA. They required all employers to record all work-related injuries and illness, meaning keep track of all your COVID-19 employees that were tested positive. You must put that in your log, in your 300. I would assume, you know what is an OSHA 300, right? OSHA 300, OSHA 300A, OSHA 301. These are the logs, more so the OSHA 300A that you have to post, okay, from February 1 to April 31. Remember, you know this. You should know this. So this is a log that you keep track of all of your COVID-19. So they came out with that guidance. You have to keep track. So therefore, if OSHA will come into your building and you don't have this log, automatic, you will end up with a citation. So they came out with a guidance. Keep track of all of your COVID-19 employees. But I will explain later because not necessarily that every time you have a COVID-19 employees, you will immediately log. No. I will explain to you. And for purposes of COVID-19, they also required employees to report to OSHA any work-related illness. See? That results in death. That's number one. Number two, that resulted in serious injury or illness in this instance, because COVID is an illness, not an injury. Where the illness has resulted in inpatient hospitalization. See? So there are only two instances, therefore. Call OSHA when there is death. And second, serious illness that cause the employee's hospitalization for more than 24 hours, not for purposes of observation, but for treatment. If only for observation and discharge within 24 hours, then that is not considered to be serious illness, and you don't have to report. See? The word is requirement, remember, because if you don't report, under these two circumstances, you end up with a deficiency. Now, so let's move forward. In early April, OSHA came up with a guidance. See? And what are these guidance? Respirator use and training. Addressing N95 shortage. Guidance for fit testing of PP. Enforcement of recording cases of coronavirus in the workplace. See? They were already ahead. So, in other words, our employees, of course, one of the PPEs is, of course, the use of the respirators, the N95. And not only the N95, the surgical mask, any type of filtration materials that an employee uses that goes to the workplace, they must be properly trained. And this must be part of your respiratory protection program. I don't know if you're familiar with that. And this must be part of your aerosol transmissible disease and exposure control plan. That is part of that. Now, so you must have this in place. You don't just give an employee here, here's your N95, here's your surgical mask, or here's your goggle. My friends, you have to train them. Because if you just use it, it does not automatically protect you from the virus. No. There is such thing as fit testing or seal testing. Now, I don't know if you have been subjected already by CDPH that you failed to fit test your employees. The requirement under the law, under the Respiratory Protection Program, is annually, once a year, and initially. But because of the COVID-19, and because of the shortage of the N95, they waive, CDC waive the annual. But we need to have the initial fit testing. It doesn't mean, my friends, that just because you have your N95, you can already go to the COVID wing or to your POIs or your quarantine. It doesn't automatically mean that you're already protected. It must be fit tested as to style, the size, the model, and the make. So, you go through a process of a fit testing. And there are two ways of fit testing. One is qualitative fit testing. Qualitative. Normally, we use the Bitrix test. It's a bitter taste solution. And the other one is the irritant smoke. What am I talking here? You know, you use a hood, like an astronaut. And then, we put the solution in a particular, bottle, and then we squeeze for 10, 20, or 30 times. And if the 10 squeeze, you can taste the Bitrix, meaning, therefore, that your N95, the subsequent test we're going to do, there is a procedure, you move your head left and right, down to low, you're going to bend. If you don't taste or smell the solution, meaning you pass the N95 testing. And just to give you an example. And the other one is quantitative. That's what you use a port account. Where your N95, and then there is a probe connected to the port account, and then we run it with the procedure. You bend, you jog, you laugh, you smile, and then we will see if you will pass the test. If you pass the test, meaning that N95, that is the kind of N95 that you're going to use for 1 year. Meaning the style, the make, the model. That's what it means. You see? So anyway, that is a different subject matter. Let's move forward. So around mid-April, OSHA issued COVID-19 Interim Enforcement Response Plan. See? Because it already heightened. There were already a lot of employees that were COVID-19 positive. They were already exposed. They even abandoned you. They were fearful of coming to work. And then, so what they did, OSHA came up with an enforcement response plan. So now, because of the complaint letters, their focus is due to the lack of PPE and training. The donning and the doffing. So they check that. And their priority is in the healthcare industry. The frontline healthcare workers. They will not go to non-healthcare and non-emergency. They prioritize it. The focus is in the healthcare industry. You see? So that's why we have to be prepared. Do we have the sufficient PPE? Did we train them on how to use the PPE? Do we have the N95 fit testing? So we should be prepared because they are going to inspect and they are going to review whether we are in accordance with the standards of OSHA. Otherwise, we will issue us a citation. You see, employers should be prepared to provide a written pandemic plan, which is already your mitigation, COVID-19 mitigation plan, infection control plan. I'm sure you have that, even before the pandemic. And then protocols for PPE use, records of employee infections or exposures. You must keep track of them. And the training records related to COVID-19. I'm sure you have your in-services since March and continuously. So they were advised, the field inspectors, you have, focus on the high or very high exposure sectors, and that is already us. You see? Now, late April, guidance, discretion memo. They directed local field offices to take a practical approach to enforcement of training, auditing, equipment inspection, testing, and other essential safety industrial hygiene services. So what do you mean by practical approach? So in other words, they instructed their field inspectors, don't be too harsh, don't be too stringent, don't go by the book, because in these pandemic times, all of us were not prepared for this, right? This is the first time that we went through this. So soften up also, but see to it that the basic, the elementary components of their program must be in place. And if for some reasons they failed to do 1, 2, 3, but if you have seen that in good faith they tried to approximate or implement the plan, then do not issue them a citation or a civil monetary penalty. See? Then, let's move forward. They came up again. Another one, an interim response plan. So they said, if the infection in the community has been reduced, they were advised to return to pre-COVID protocol. Meaning, you will become strict. Be strict. So, like in Los Angeles County, in Davidson County, since the community acquired, the numbers are high, they will not go to the pre-COVID protocol. They will use the practical approach. But once the numbers goes down in your community, then they will go to their original. They will be very strict. So they came out with this. Where to prioritize, where not to prioritize. And of course, our industry, we are their priority. And they are very practical. See? And they can do either on-site or remote. But they were advised, if it's not practical, just do remote. Remote. But if there is an exigency, like death or serious illness, then they have a rapid response team. They will go into your building. Other than that, they will not knock on your door. They will just do it by remote. It could be to video. Turn on your video. I want to see your physical plastic barriers, whether it's sufficient enough to protect your employees. You see? And let me see your donning and doffing station. So it's a virtual tour. Did they did that? The answer is yes. One of our facilities had that. The OSHA, because I reported there was a serious illness where our employee, was admitted in the hospital. So you better be prepared with that. Now, OSHA federal. OSHA federal. Are there OSHA state? State. Meaning the 50 states. Can they also create their own agency? My friends, yes, they can. They can. So if you see this dark blue map, these are state OSHA approved plans. So on top of the federal OSHA, they can come up with a state OSHA. So if you see California, that's what we call CalOSHA. See? So when you hear the word CalOSHA, meaning it is a state OSHA. And among the 50 states, California OSHA is the worst. They are very, very strict when it comes to enforcement. The rest, more or less, just moderate. But CalOSHA, they are very strict. And unfortunately, we are in California. And there are 22. Out of the 50 states, there are 22 state plan, including Tennessee. You see here, TN. So they also have their own CalOSHA. Now, what is required? So you will say, oh, they're competing with federal OSHA. We are getting confused. We have federal OSHA, we have CalOSHA. No, there is no confusion. All federal OSHA guidelines are adopted by the state. The state can go beyond what federal OSHA has. So meaning federal OSHA is the minimum requirements. So the state OSHA can come up with maximum regulations. You see? So that's why here in California, we have to be very careful. So there are 22 state plans which covers both private sector and local government. The rest, the non-dark blue, they don't have. So they just rely with the federal OSHA. So federal OSHA, they have compliance officers or field inspection officers. Can a state OSHA inspector and a federal OSHA inspector both undertake inspection in a particular employer or building? The answer is yes. They can do that. See? So this will not stop a federal OSHA to also do its own inspection. However, if you take a look at this, federal OSHA is a small agency. You see? In 2010, according to the General Audit Report or GAO office, they only had 1,016 compliance officers or inspectors. And instead of growing, they went down. 952 inspectors. See? And worse, last year they went down to 875. And that covers 130 million workers. And there are 8 million work sites around the nation. So you will say, oh, they only have 875. Let's not worry. We will not be the subject of an inspection. My friends, we are just talking of federal OSHA. We have state OSHA. So don't raise your guard. And worse, if there is death or serious injury illness where we are required to report, then they will come into your building. CalOSHA. Now, this is your OSHA version in California. They are not called field inspectors. They are called CSHO or Certified Safety and Health Officers. So how many do they have? 254 CSHO. But only they only have 212. 42 still vacant. See, there are only few inspectors. But even though there are few inspectors, I'll tell you, they are the worst. Why? Because I have experienced this most recently. So any one of you who would like to entertain or join CalOSHA, be a certified safety and health officers because there are still, 42 positions available. Okay? Now, CalOSHA is not a standalone agency. It is part of the Department of Industrial Relations. See? Division of Occupational Safety and Health Administration, Safety and Health. DOSH. They are under DOSH and they call themselves CalOSHA. The role is to protect and improve the health and safety of working men and women in the workplace in California. And there are 20, you see, even though they only have field inspectors of 218 or 19, but they are spread throughout the state of California, from north to south, from Eureka down to San Diego. 20 field offices. You see? Now, these field offices, you should print this. Why? Because if you have a serious injury or illness or death, then you have to call within 8 hours. So you must know where to call because the law states the nearest CalOSHA district office. See? So earlier, I kept on saying, within 8 hours, you report when there is death or serious injury illness. My friends, it doesn't mean it is automatic. Only if the death or the serious injury illness is work-related. So if it's not work-related, then you are not required under the law to report. Assuming there is a COVID-19 positive employee. And then, God forbid, that employee died. Or, God forbid, the employee has to be hospitalized for care and treatment. Do you have to report it immediately? The answer is no. You, of course, we have to report it within 8 hours. You have to conduct an investigation whether it is facility acquired or community acquired. So if based on your internal investigation, it is community acquired, then you don't report to OSHA. See? You really have to be very mindful of this particular fact. If not work-related, do not report. I should know it because I already reported 5 and based on my investigation, it was work-related. But there were more than 15 that I did not report because I knew that it was not work-related. If you have a building that is COVID-free, do you think that employee was COVID positive as a result of working in our workplace? The answer is no, because we are COVID-free. Or if the employee is assigned in the general population, not one of the co-workers, not one of the residents has been COVID-19 positive. Are you going to report? Most likely, it is community acquired. You see, you should also conduct your own due diligence before you report. Because, remember, when you report, I'll tell you, they will knock on your door. Or if not, they will just send a letter or call you. And they'll go to the motion of submit the following documents, which I did just recently, around 4 to 5 inches in thickness. They will ask everything, but that is a long story. So, despite the few certified health and safety inspectors or CHSOs, California still leads the nation on worker safety. See? They conducted the most inspections in the nation. Would you imagine that? 7,571. And they've cited 18,896 hazards. And we are already one of them, meaning the other consultancy that we had last year. Good enough? We were able to reduce from $5,000 to $3,000. Why? Because we failed to report within 8 hours. See? Failure to report within 8 hours. We reported after 8 hours. Issued 5,000. That's automatic. But I was able to reduce it to 3,000 because of good faith effort. See? Good faith. Our first-hand knowledge regarding the inpatient hospitalization of this employee, we only knew after 2 days. You see? So anyway, that's a long discussion. And the enforcement of what they did and the outreach activities contributed to a lower rate of fatality. You see? So that's why they are always out there in this regard. Now, so you heard the word OSHA inspection. So there are the different types of inspections that is being conducted by CalOSHA. One is when there is imminent danger or situation. This one, you don't have to report. You don't have to report. Any employee can report. Or any neighbor can report. Any visitor can report if they see in your building that your employees are in imminent danger. So what is that imminent danger? If there is a situation or a condition in your building, whether physical, chemical, infectious, that would likely cause harm or injury to your employees, no need to report. CalOSHA will just come in. 2, accident investigations. Accident investigation means you reported death or fatality or serious illness because of inpatient and then resulted to inpatient hospitalization. When there is severe injuries and illness, you have to report it within 8 hours. Of course, when there is a complaint coming from an employee. And if there is a referral means, very simple. CDPH, your surveyors came into the building, conducted an inspection, a focus survey on infection and control, and if they notice or perceive, perhaps, or based on facts, objective, that the employer is not providing the necessary PPE or the numbers of our COVID-19 employees, they are high, or they can call CalOSHA. CalOSHA, can you please go to that building, to Los Palos or Secres? The employer there does not provide them necessary PPE. They have a high number or volume of COVID-19 employees. That is referral. Targeted inspections means the industry belongs to the high hazard industry. And we are automatic. Top 5 is belongs to the healthcare industry. Our healthcare workers. So, with or without a complaint, they can just conduct an inspection. Of course, the last, every time that they inspect, there is always a follow-through. They want to find out whether we have abated or corrected the deficiency or the citation that they have issued. So they do that in order of priority. There are certain programs that you must have in place. And if I say these programs, you should have this. And if you don't have this, 101%, 101%, they will issue you a deficiency or citation. So number 1, you must have the Injury and Illness Prevention Program. INIPP. Or it could be I2P2, IIPP, no matter what. They're just the same. It's Injury and Illness Prevention Program. That is required under California Code of Regulations, Title 8, Section 3203. This is your Bible when it comes to your safety, employee safety program in the workplace. So, if they will ask you, do you have a policy and procedure on your employee safety program? My friends, this is what it means. The Injury and Illness Prevention Program, which I'm going to explain later. You must also have in place the Aerosol Transmissible Diseases Exposure Control Plan, or ATD Exposure Control Plan. That is requirement under the California Code of Regulations, Title 8, Section 5199. This came into light, it became significant because of this pandemic. Why? Because COVID-19 is an infectious disease. It is a healthcare-associated infection, aerosol-borne, for 3 hours. See? That's why we put plastic sheet barriers, so that there will be no cross-transmission or contamination. So this program, you must have it, because this will help you on how to protect your employees. Then, you must have your respiratory protection program. That is under California Code of Regulations, Title 8, Section 5144. Do you have this? You must have this. Then, of course, you must have this. Under California Code of Regulations, Title 8, Section 3380, you must have the personal protective devices, policies, and procedure. See, there are 4. INIPP, you have your ATD Exposure Control Plan, Respiratory Protection Program, and your personal protective devices, policy, and procedure. 4, automatic. All inspectors will ask, do you have it? See? Now, this is just to give you an idea. The role of an employer is to protect its employees, right? We have to protect our employees from all forms of hazards. It is all about the safety of our employees, my friends. So there are certain hierarchy of controls. How are we going to protect our employees? See? This is just for educational purposes. Educational. So if you see, it's an inverted triangle. Inverted. You call that hierarchy of control. So in order to protect the employee, you go through this motion. Can we stop this hazard to protect our employee by eliminating? See? Elimination. So what does elimination? Meaning physically remove the hazard. You see? So if you cannot physically remove the hazard, in order to stop the hazard or protect the employee, then you go to the next. Can we replace the hazard in order to protect the employee? Now, if you cannot, then you do engineering controls. which I'm going to explain shortly. Then, if you cannot, or if you can do this simultaneously, you do administrative controls. And the last is PPE. See? Done with engineering, done with administrative, or cannot stop at all, then give them PPE. See, that is how it works. But in these pandemic times, you cannot basically remove the hazard. It's airborne. Contact, direct and indirect, cannot remove, right? You cannot also replace the hazard because it is not something physical. It is invisible, intangible, cannot see. So elimination, substitution of this type of hazard chemical cannot. So the only way that we could control to protect our employees is through engineering controls, and that is what we are doing. Cohorting. You put plastic shield, a plastic sheet, and then you put also the fire door barriers because you're isolating from the transmission, protect the other employees. Administrative controls. This pertains to changing the behavior of your employees. You have that, right? The donning and the doffing, the screening protocols that you have. These are your administrative controls. You modify the behavior of your employees. And, of course, the personal protective equipment. You see, these are the ways to eliminate, mitigate, and reduce the hazards as it relates to the safety of your employees. Now, we talk about the INIPP, Injury Illness Protection Program. There are a lot of complaints coming from employees. You know what? That employer, they don't even have an injury illness prevention program. It is even foreign to them, alien to them. We have not seen the INIPP. So that's why you need to have one. That's what it means. Because the INIPP outlines everything. How to stop, eliminate, prevent, and reduce the hazard. Everything is there. Hazard identification, hazard assessment, accident investigation, training, etc., etc. See, that's one of the complaints. And here you go. The complaint. And then, OSHA said, where's your INIPP? Because this employer is making their non-essential office staff to continue coming to office. You see, they are non-essential and you force them to come to work. If they don't want to work, then you cannot do anything. And then, there are also employees that complain to OSHA. You see, the employees there are not wearing masks. And what is your INIPP? Your INIPP states to that effect that you must protect your employees from any forms of hazards. So they will use the INIPP against you. You're not following your INIPP. Employers not complying with social distance. See, you just allow your employees to communally gather less than 6 feet, and there are no signs. You're in violation of the INIPP. No one is wearing masks during meetings. You have a meeting in the administrator's office or wherever it is, and no one is wearing masks. So employees saw it. Employee can call OSHA, and they will use the INIPP to issue a citation. And employers not providing their employees with face masks or any forms of personal protective equipment. See, this is what they're going to use. INIPP, protection of the employees. Now, employer, they are required to provide PPEs to your employees. Yeah. You cannot say, well, you have to provide your own PPE before you come to work. There is no such thing as that in this pandemic. There is not. Before the pandemic, yes. But N95s, if you are going to assign or the job description of an employee is in a high hazardous area, like in housekeeping, like in maintenance, or anything that involves solutions, you are required to provide. But if not, then no. But in these pandemics, everything is required. Now, there is also a complaint, and they use the ATD exposure control plan. You see this complaint. Employee tested positive for COVID-19. See? And the complaint was because the employee who was tested positive was not wearing PPE at all times. See? And then the employer told the employee, okay, it is safe because the employee was actually wearing PPE at all times. But It is not true. See? The employer is lying. So these are the type of complaints that they get in OSHA. And then here's another one. Employer does not believe the clinic needs to be closed down for cleaning. Would you imagine that? A clinic must be fully sanitized. In fact, it must be deep clean. So perhaps these employees that they send to the clinic for COVID testing to check their diagnosis doesn't like to go there because they don't clean. Oh, so they complain. So all of these are just examples. Oh, see, there was also a complaint pertaining to personal protective devices. Employer is not providing adequate PPE for curbside pickup. See, perhaps this pertains to the service industry. Employer has not provided face shields, gloves, nor aprons. Employer has only provided employees with disposable face masks. See? Any deficiency or the non-provision of PPE, an employee can report. So you better be very careful. Because if they do report, conduct an investigation, they will ask, do you have the personal protective policy and procedure prior to the COVID-19 and after the COVID-19? I should know. Because I just submitted all of these requirements to CalOSHA, the nearest district office. Because I reported an employee who has been hospitalized, now still coma for more than 2 months. One of them is this. They ask if you have this program. See? So, personal protective devices. Let's go into this specifically. Under this particular California Code of Regulations, the terms protection and protective mean, just go through it. Safeguarding obtained by safety devices. Can you just turn it off, my cell phone? Excuse me, sorry for that. Just silent mode it. I will not answer any call. They can leave their voice message if they want to. So the terms protection and protective mean safeguarding obtained by safety devices and safeguards of the proper type for the exposure of such design, strength, and quality as to eliminate, preclude, or mitigate the hazard. See? There is a definition for your PPE. Number 1, it shall be marked to identify the manufacturer. You always remember this. When you do your N95 fit testing, it must be NIOSH approved. In other words, there should be a letter N, I-O-S-H, NIOSH. If it is not NIOSH, number 1, you will end up perhaps with a deficiency from the surveyors. Number 2, if we are going to fit test you, either the quantitative or qualitative fit testing, by the way, I'm a certified fit tester for N95. We will not test if your N95 does not have NIOSH. So what does NIOSH mean? It means National Industry on Occupational Safety and Health. That is the arm of OSHA that does research and development pertaining to all types of PPEs. And what else? Employers shall assure employees instructed and use equipment in accordance with manufacturer's instruction. See? You don't just give an N95. Here, use. I mean, there is a way. Any PPE, there is a manufacturer's how to use. And then all of this, just go to this. Ensure that safety devices comply with Title 8. It must be in a safe sanitary condition. There is a new AFL regarding N95. I'm sure you're aware of this. I just forgot the particular AFL number. Whereas as a result of the shortage of N95, you can extend its use, extended use. And the other one is you can reuse. But there is a difference. Extended use, because normally when you wear your N95, during your break, or during interruption of any types of services in your COVID wing, you have to dispose it, right? You have to wear again another N95. But they would allow an extended use. The surveyors are not going to write you up for that. But there is a procedure when you are going to reuse it again for that particular shift. What about shift? Reuse is different. Reuse, you don't throw your N95. You bag your N95 for at least 72 hours, I guess. Bag, and then properly mark. What date? After 72 hours, can use again. Not necessarily throw. You read that particular AFL. Okay? Let's move forward. So, your personal protective devices, you just go through all of this, everything. But what is important here, you must train them on when to use, what to use, how to don and doff, and its limitations and care. And we have to train them, and they should demonstrate to us on how to use it and how to dispose it. I'm sure you're already the master of donning and doffing, right? To avoid infection. That's very important. And the training is also very important. And it's also important for you to identify whether they are defective or damaged equipment. Because if they are, then throw. Otherwise, you will end up with fatality. Right? So you have to be very careful in that regard. Now, new CalOSHA guidance by industry. So now, we're going deeper. This pertains now to California OSHA, meaning our state. So they came out with a lot of guidance. You see, if you take a look at this, the gym. So if they open up their gym, there is a guidance. They will open a hotel, there is a guidance. Healthcare, you see, I highlighted it, healthcare. They have a guidance. So you have to take a look at this. I want you to listen carefully, one by one, as I move along, because this pertains to CalOSHA. So this is their guidance. You see? Employers must establish and implement an injury and illness prevention program, or IIPP, or I2P2, or INIPP. See? To protect employees from worksite hazards. What did I say? You must have this in place. This is your safety program. But the one that we have for years does not include infectious diseases. None. It is more on physical hazards. Nothing to do with the chemical hazards. So you have to revise your INIPP that would include now infectious diseases, because COVID is an infectious disease. So if they want you, this is their guidance, it doesn't mean they're imposing any legal obligation. It's just that we want you to revise, you amend your current IPP and put policies and procedures pertaining to infectious diseases as it relates to the safety of your employees. Very easy. Train and provide PPE. Train on how to use donning and doping. Just put that there in the INIPP, you're already in compliance. See? So that is one of the guidance. What's the other guidance? You are required use of face coverings when engaged in work. You see? Now, which is obvious. All of us are wearing. We are required to use face coverings, and that should be in your INIPP. And when interacting with the public, working in spaces visited by members of the public, areas where food prepared. So all of this, you must have this. Of course, the rest of these activities here, it does not pertain to us. So we require use of face coverings when all employees are in the workplace. Very easy. Put inside the INIPP. And then you must also have a workplace-specific plan in your INIPP as it relates to infectious diseases. So anything that pertains to the CDPH regarding face covering guidance, incorporate, just put it there. And then the contact information of local department, meaning their number, contact, put it in your INIPP. And then train and communicate with workers and make plan available. So when you do your in-service on donning and doffing or any pertaining to the COVID-19, put it in your INIPP. And then regularly evaluate workplace for compliance, document, and correct deficiencies. Put them in your INIPP. And then if you're going to conduct investigation of employees that were COVID positive because you want to find out whether it's community acquired or not, or work-related or not, then put it in your INIPP or create additional binder that is more or less, in relation to your INIPP. And of course, your contact tracing. You see, identify those in close proximity and quarantine as necessary. And that is one of the workplace-specific plan. That is what you mean contact tracing. See, because you are trying to protect this form of hazards to our employees. So it pertains to your INIPP. Put them, your policies and procedures on contact tracing. Topics for worker training. Oh, you're doing all of this in services. And then you come up with a curriculum. What are the in-services as it pertains to the COVID-19 in relation to ensuring the safety of your employees? Put it in your INIPP. Anything as it pertains also to disinfecting and sanitary procedures. The high-touch, low-touch surfaces that you train your housekeepers in order to protect them. See, you can also put that in your INIPP. Individual control measures and screening. This pertains to your screening protocols. Put them. A copy of the policy and procedure in your I2P2. See? Temperature and system and symptom checking. And perhaps part of your policy and procedure, you don't only brief them or train them on how to protect themselves in the workplace, but also when you are at home. See? Good defense is, and the good offense is always proactive. You brief them. When you are at home, please observe all of these things. Because when they do that, then when they go to the workplace, we get ourselves protected already. Train them. So you just tell them also. That will be in your I2P2. Encourage workers to stay home if sick. If you are sick, if you have the signs and symptoms of the COVID, please do not come to work. And then, the value of hand hygiene, 20 seconds, before and after. The 5 moments of the hand hygiene. I already trained you that. Put that in your INIPP. Now, this one is also important. See? Post signage regarding physical distancing. 6 feet. Face coverings. Wear masks. Wash hands. You must have a posters. Visible. My friends, this is not a joke. I'll tell you. 2 days ago, we had a focus survey in one of our buildings. And what stood out? No signage. There were signage, but lacking signage on social distancing, on hand hygiene, and wearing of face masks. You see? Focus survey. We end up with the deficiency, lack of materials visual on those 3. And the other one, your hand sanitizer, they did not fill it up. Did not fill up. So the surveyor used the hand sanitizer, nothing came out. No gel, no foam. Deficiency. So you better watch out for that. That too. They're going to do that. Now, cleaning and disinfecting protocols. You must have it. So I already discussed that with you. The environmental surfaces. You see? The high touch, the low touch, deep cleaning, sanitizing, disinfecting, and then your chemicals, how you store them, everything. You must have it. Just put it in your I2P2 or INIPP. You see? Physical distancing guidelines. It must also be in your INIPP. I sound redundant, but this is what it is. So have them. We already know that. See? And physical distancing, that only pertains, you have to stay away from me 6 feet. I'll put that in the policy and procedure. No. Implement physical distancing by spacing or barriers. Or you will also have, I don't know, if you allow work from home, I really don't know. If you're going to reconfigure some of your workstation where you have to put a barrier, a plastic sheet, take a picture. You can just take a picture and then put it in your INIPP. Or perhaps to change the movement along the hallway. Please do not enter. See? I don't know what. In north or south wing. Put it in your INPP. Or perhaps just take picture. If we are, more or less we are busy, just take picture. Put it there. Because picture speaks 1,000 words. You don't have to write. Picture is enough. So, best offense is a good defense. So, again, repeat. I still have time. INIPP. You must have an INIPP. So, what does an INIPP mean? There are eight. Remember eight. Important elements of the INIPP. One is, who is responsible in the implementation of the INIPP? It doesn't necessarily have to be your administrator, no. Even the rank and file, you can put them as person responsible. Even a department head, you can put that. Anyone would like to elect, I want him, because this is about your employees, you have to empower them. It is not top to bottom. Just because you're a manager and you want to do this, you enforce this to your employees, I would rather have bottom to top. You see? If there is a rank and file employee in maintenance or in housekeeping who has been a long-term employee and who has the potentials, who could be a leader, who has the personality, who has more or less, it doesn't have to be intelligent, but smart, always observing safety, then let him be the head of the safety committee. Head! You have your safety committee. So that is the person who is responsible to implement your INIPP. Well, there must be a compliance. Compliance is a failure to undertake or to comply with our safety protocols, etc., is subject to safety council or progressive disciplinary action. So there must be hazard communication, hazard assessment, and identification. Of course, accident investigation. There must be a component of that. Every time there's an injury or illness or an accident. So you must have your incident report. How do you conduct your investigation? How about the corrective actions, etc.? There must be a component of hazard correction. Just because there is an injury and you will just conduct an investigation, submit the incident report to the administrator perhaps or to the DSD, and then arrange this injured worker to go to a clinic, and that's it, my friends. You have to correct the hazard. Otherwise, there will be a repeat of the injury. So you always want to find out the bottom line. What caused this injury? See, that's part of your accident investigation. If the cause of the injury, remember the hierarchy of controls, we can physically remove the hazard, then do. If not, substitute. If not, engineering control. If not, let's do the administrative. If not, PPE. See, always memorize. Hierarchy of controls if we want to correct the hazard. Of course, safety training. Everyone should undergo safety training. And among many things, record keeping. Record everything. Now, we are done with CalOSHA guidelines. We are done. So, I would assume that all of you have understood and you must implement it. But this subject matter is very important. So, Governor Newsom, on May 6, 2020, issued Executive Order number 6220. What does this mean? It is easier for an employee to file for workers' compensation benefits arising from COVID-19. You see? For as long as the employee has been COVID tested positive and diagnosed as COVID positive, there is a presumption that an employee, that the illness was work-related and must be entitled to all the benefits under workers' comp. See? That's EO 6220. But this is only limited. Only if you were diagnosed from March 19, 2020 to July 5, 2020. So we are now in August 21. August 21, I guess. So no more. But if they got the COVID-19 diagnosed and positive and it's work-related, the employer cannot argue. Because basic in workers' comp, before the pandemic, there is no presumption. An employee who files for workers' comp has to prove through medical evidence that his injury or illness arise out of employment or in the course of employment. See? They have to prove through medical evidence when they apply for workers' comp. But this particular executive order, no, they don't have to prove. Automatic. Automatic. It's considered to be work-related. But it's only limited for this period. But there are certain tests. It doesn't mean automatic just because you have COVID-19. No. I will show to you that there are certain tests that they can be considered as having a presumption that it arose out of employment. So let's move forward. The reason why they came out, Governor Newsom, this executive order, because they will say, oh, this is crazy. You know, we are already burdened with all of these expenses, and here comes the state of California, instead of helping us, no. Because according to them, with this benefit, it will reduce the spread of COVID-19. In other words, this is part of their mitigation effects. Why? Does it sound right? It looks like it sounds right. But if you're an employer, you will feel bad, right? Because if they will not be given that benefits, according to the state of California, if we will not give them that presumption, tendency is, then they will not be provided the necessary care. And so what would happen to them? If they will be neglected, tendency, if they're at home, everyone in the family will get infected. So it spread the COVID-19. So that is the reason. So more or less, it sounds also good. So the order creates a presumption that it arises out of and in the course of employment. Remember this, AOE, COE. An injury or illness is not work-related unless it arises out of employment or in the course of employment. You always remember that. So if they passed the test on AOE, COE, then they're entitled to the benefits under workers' comp. But prior to this EO 6220, the employee has to prove via a medical evidence, meaning he has been seen by his primary care physician, that his injured illness arose out of employment. But the 6220, no more. Automatic. If it's work-related, the presumption is he must be entitled to workers' comp. But there are certain tests. So while I use the word automatic, it doesn't mean automatic, I have COVID-19, file a claim, workers' comp. No. So the COVID happened outside of the workplace, outside of the residence. It must be in the workplace. In other words, it must not be community acquired. That's number one. And the COVID-19 of this employee, there must be a diagnosis that is COVID-19 made by a physician and surgeon license here in California. See? I cannot just claim, oh, I have COVID-19. No. You have to be diagnosed by a primary care physician that indeed you have COVID-19. And not only that, yes, you have diagnosis, but you must be tested positive that you have COVID-19 within 30 days of the date of diagnosis. Do you get me? So you cannot just say, oh, the presumption is there, you're COVID-19, I must be entitled. No. Show me a proof that you were diagnosed by a primary care physician, that you have COVID, that you have COVID, and number two, within 30 days from the first symptoms that I tested you with the COVID testing and you end up positive. See? That's number two. Number three. And the diagnosis must be made within 14 days. See? Meaning during the quarantine period. So if the diagnosis was made after 14 days, then no, it's not automatic. There is no presumption. And number four, the work at the employer's location occurred on or after March 19, 2020. And only up to July 5. So if you are COVID positive before March 19, no, not covered. You have to prove your case. So there is a fourth part test. So are we clear? So in other words, the diagnosis must happen within 14 days from the last date of your work. And the diagnosis, number 2, diagnosis was made by a licensed physician. See? And number 3, within 30 days thereof, you have been tested COVID positive before the presumption will apply and for you to be entitled. Now, so the duration of this presumption, my friends, is limited. March 19, 2020 to the July 5, 2020. And this has not been extended anymore. No more. So if you got the COVID-19 after July 5 or July 6, now you have to prove there is no more presumption. So you have to produce medical evidences, you're going to file and submit all of these documents, and the employer will say, oh no, you know what, it's not facility acquired, it's community acquired. See? Not unlike if you fall into this particular period, no need. Presumption is there. So let's move forward. So the presumption is not conclusive, but rebuttable. You know what is rebuttable? In other words, we can refute the employer. So while the presumption states that he has COVID and is work-related, the employer on the other end can rebut, submit evidences or information that it did not arise out of employment or in the course of employment. So in other words, this law is also fair for the employer. And if we are going to rebut the employer, we only have 30 days to rebut. Only 30 days. So if an employee will file a claim for workers' comp as a result of the COVID-19, the presumption is there. He does not have to prove except that he will just submit a doctor's note that he was certified COVID and has been tested COVID positive and was done within 14 days. That's enough. Covered immediately. But we have 30 days, within 30 days to refute and say, you know what, it's community acquired. Now, can we do it after 90 days? The answer is yes. If there are new evidences that surface after 30 days. See? Now, when you are now covered under workers' comp, assuming, there must not be delay in the payment. There must not be delay in the payment. So if an employee will file for workers' comp doesn't automatically pay you because they have to set up the claim. So normally, it takes 2 weeks. So but this EO 6220 said, we don't want any delay. See? In no event shall be there a waiting period for temporary disability benefits, which I'm going to explain shortly later. So the employee, if he has a paid sick leave, immediately give him his paid sick leave. And then later, workers' comp now will pay for the temporary total disability. Remember that. So whether they like it or not, here's your paid sick leave. I don't know. In your case, I guess it's only 24 hours in 1 year. See? Give them automatic and the rest, workers' comp will pay for the TTD. Now, I will explain this briefly to you because this is an entire subject matter of its own that will take me around 1 hour and 30 minutes. So there are a lot of benefits an employee is entitled to under workers' comp. We are not only talking of COVID-19 employees that are under workers' comp. So you're entitled to medical costs. Everything is free. Anything that pertains to medical, your medication, your surgery, your therapy treatment, your doctor's visit, clinic, the hospital, everything that will cure you, that will rehabilitate you, that will provide you therapeutic treatment, everything is shouldered by workers' comp. Now, if you are not working because your doctor said, well, you know what, this employee of yours cannot work, then you get paid. And that is what you call TTD, Temporary Total Disability, TTD. Place of work, but you only get 2/3 of your average weekly wage. 2/3. So we submit 52 weeks of your wage statement to the carrier, and then they will average it only 2/3. That's what you're going to get. So in other words, you don't get rich with workers' comp because you only get paid 2/3. TPD stands for Temporary Partial Disability. What it means is that you are working modified but not full duty. So the difference, because if you will be released by a doctor and the doctor said, okay, physical restrictions, not to lift, not to push, 10 pounds, 15 pounds, and then Nestor perhaps will say, or Susanna will say, oh, we can accommodate him, Joey, but only part-time, only to work 4 hours on, in a 3-day period. Okay. So what would happen is, because of the difference of the lost wages, then workers' comp is going to pay the difference. That's what you call temporary partial disability. Permanent disability or PD, meaning you have already reached your maximum medical improvement, MMI, or you are already declared physical and stationary, PNS. No amount of surgery, no amount of medical treatment will make you better. So if you have reached that point, then workers' comp is going to pay you permanent disability. And it all depends on the rating. So if it is your right hand, permanently damaged, permanently injured, and it has been rated by the doctor that 15% out of your 100% full capacity of your hands is already affected, then there is a fee schedule. 15% of that, say for example, it's 15,000 times your age, length, 82 years old. That's how they rated it in America. Then you get that amount. So if it's 20,000, then you get the 20,000. That's it. Now, SJDV stands for Supplemental Job Displacement Voucher. If your employer cannot accommodate you anymore, cannot, and you have permanent disability, then you're entitled to $10,000 to Supplemental Job Displacement Voucher because you cannot return anymore to your usual and customary occupation. Say, for example, you're a CNA, but it's sort of your personal disability, permanent disability, you cannot perform the job of a CNA, you'll be given $10,000. But it doesn't mean, oh, here's $10,000. No, you don't make money out of it. You work with workers' comp, you identify what particular school where you want to get not a degree, like a vocational. So you want to be a computer literate, perhaps you're a housekeeper, you want to know about computers, you go to the school and workers' comp will pay up to 10,000. So you want to have a laptop, then it will be taken out from the 10,000, but you don't get that money. So allocated expense cost, well, I will not discuss this anymore. It's too long. You're entitled to attorney's fees if your claim is represented by a lawyer. Any sub rosa or investigation that your employer would request, that will be also paid by workers' comp. Any bill review, all of these invoices, all of these expenses, there is what you call utilization review. And then death benefits also.
Hello.
Yes.
May I? Licensing is here.
Yes, that benefits, they are entitled to, I'm doing a Zoom seminar, ma'am, excuse me. Death benefits, so they're entitled to the death benefits, including funeral and dependents. So death benefits means is that it depends how many dependents you have. So the dependents would be 1 dependent, 2 dependents, 3 dependents. If you only have 1 dependent, the amount is 280,000. 2 dependents is 290,000. 3 dependents is 320,000. So when we say dependents, this pertains to your children less than 18 years old. See? So when you die, in the course of employment, they get that. See? Funeral is only up to $10,000. So at least briefly you know what are the benefits under workers' comp. Okay, I will just run this because we're almost there, 12 o'clock. So a litigated claim is a claim that is represented by a lawyer. So you know how much is the cost? $89,000. And if it's non-litigated, it's $16,000. The expense, what I mean, we don't pay it. It's workers' comp who is going to pay. But of course, our premiums will go up because its severity and frequency. So it's not the amount. So if you take a look at this, a litigated claim takes at least more than three years in order to close. Versus a non-litigated claim, you see, it's only 1 year, it's already closed. Because why? If there is a lawyer, you know how lawyer is. They want to make money. Don't get a lawyer because 25% of the expense will be taken out by your lawyer. You're the one making them rich. You get less. And, of course, they want a longer claim, a long tail. Because the longer the claim is, the longer, then the lawyer gets make more money. And this will just give to show you. Remember, when you are in a temporary total disability, TTD, 2/3 of your average weekly wage. But, you look at this, it is capped to 1,299.43. Say, for example, you earn $50 an hour or $45 an hour. So perhaps your 2/3 weekly wage might be $1,800 or $2,100. My friends, you don't get that. It will be capped to $1,299.43. So I will not discuss this. I already discussed this with you regarding temporary disability that you will be entitled under workers' comp. Just go through it. And by the way, so this executive order applies to all type of carriers in workers' comp. It could be conventional, the conventional, traditional, first dollar coverage. It could be an insurance that has a deductible or self-insured retention of 250,000 or 200,000. And it could also be a workers' comp with a fronting company where the employer is self-insured. Regardless of their workers' compensation scheme in covering workers' compensation benefits, they are obliged to cover all workers in California if they get COVID diagnosed and tested positive. Now, this is good news to all employers. Even though you have lots of COVID-19 employees that has been reported to workers' comp, your premium will not go up. They will not use that in your experience rating. Experience rate. You call it the MODEX, X mode. Experience mode modification. It is based on the history, the number of injuries that has been reported. My friends, do not worry. Even though you have COVID-19 employees, 100 reported now. Next year you apply, renew your premium, it will not affect. Because the Workers' Comp Insurance Rating Bureau already made it clear. Businessmen, business owners, don't fear. The premium will not increase. So that's the beauty of it. And not only that, they also amended the Workers' Comp. And so, as you know, the payment of premium depends on your payroll. Depends on your payroll. And so you can reclassify your employees. You can reduce your employees. Say, if there are employees who is working at home remotely, see, you can reclassify them as clerical in nature. Because it depends on the classification. But this is a long story. Only me perhaps can understand this. Anyway, this will just show to you that your premium will not go up in these pandemic times. Okay? Now, we're almost there. Record keeping is very important. Record keeping, when we say record keeping, automatically your head should be wired to think OSHA 300, OSHA 300A, and OSHA 301. See? That is what you call record keeping. You have to keep the records of your employees who were COVID-19 positive. Never fail in doing that. So you have to log it in your OSHA Form 300. That's what you call the log of work-related injuries and illnesses. And then what you do with that log, because I said earlier, you have to post it from February 1 of 2021, in this case, to April 31 of 2021. But you don't post the OSHA Form 300. What you post is the OSHA Form 300A. This is already the summary of work-related injuries and illnesses. So this summary will not show the name of the employees. So that's why we are required to post only the summary. It will just show the number of injuries that you have, that is COVID-19 positive, and the number of days away from work, and number of modified duties given, number of days. and the number of those employees that were transferred to another department because you cannot accommodate them in their usual and customary occupation. So what will show are just figures. And the word there is DART. DART. D-A-R-T. Days away from work, D-A. R stands for restriction, modified duty. How many days? Because when you do your log, you put the name and then you put what type of, injury, illness, and then days away from work, meaning advised not to work. How many days? And then you put there modified duty. How many days on modified duty? It transferred to say to housekeeping from activity. How many days did she work in the housekeeping? So total number of employees, then you total also. That will be your summary. DART. Okay? DART. OSHA Form 301. Oh, you don't need it because we have our own incident report. You're allowed not to use OSHA 301 form. Now, when are you going to log? We're almost there. I know you want to take your lunch. Okay? How will you log? Whom do you log? See? So you will only log when there is loss of consciousness. So an employee got injured or ill, loss of consciousness. And we know what is loss of consciousness. Days away from work, right? DART. Advised by the doctor, do not come to work. Of course, COVID. I want you away to be up for 10 days or how many days it is. Or perhaps, the symptom is only mild. You can cohort, right? Positive to positive. Okay. Return to work. Okay with you. 2 days, only 3 days. Oh, that is restricted. Or transfer to another job. Oh, you don't work here, you work in another department. If this will happen, you have to log this employee who has been injured or ill. See? So, first aid injuries, no, you don't log them. You know what is a first aid injury? Band-aid only. Went to the doctor. Doctor said, return back to work. That's it. Done. Return to work on full duty or regular duty. You don't log them. But if the doctor said, return to work on modified duty, then that is recordable. See? Now, a case is considered work-related if an event or exposure in the work environment, two things. This is what you call direct cause. Direct cause or contributed to the resulting injury illness. You are in the building, you're working in the building, then that is work-related. If for some reasons I was working and then, I trip and fell, then what was the cause? Because of my trip and fell, that's why I got injured. Right? Perhaps I broke my finger. Or I was lifting a resident. What was the direct cause? Lifting the resident and it caused lower back. Oh, that is work-related. Right? And so that is considered to be workers' comp or work-related. The other one is, this is the one, I'll tell you, you have a pre-existing injury. Pre-existing. We know, we did a physical exam, you have a pre-existing injury that your right arm perhaps got injured in a motorcycle accident. See? Motorcycle accident. And then while working in the facility, when you lifted, it aggravated your right arm injury. Oh, that becomes work-related. Aggravated pre-existing injury. You see? That is considered to be work-related. So basically, these are just educational. But of course, there are also certain exceptions, my friends. Anything that is not work-related, you see? Not work-related. You have to do an investigation. If it happens outside the workplace, if it happens at home, or attending a party, went to Las Vegas, it's not work-related. Or even though you're in the building, you have already clocked out during your rest period, your meal period. If something will happen to you, not work-related. Or you went outside of the building to do an errand during your break period, this is not work-related. Or during your break, you were eating, and while eating, you choke. You choke. And in the process, perhaps we call 911. That's not work-related. Because you're eating, it is not part of your job description. It's not a job. Right? You see? So these are just examples. Or perhaps headache, or you got flu, stomach ache. That's not work-related. You see? That is not covered by workers' comp and not subject to recording. And so, those are the things that I have already covered. I've already discussed this. Now, so let's go to COVID. This is the last. So, COVID-19, you only record them. This is the most important before I end. Only if they are COVID positive. That's number one. Number two, only if it is work-related. So, if the COVID-19 positive is community acquired, you don't record it. See? So those are the only instances when it comes to COVID that you are going to record. But those COVID-19 positive that had serious illness went to the doctor, you should also record it. But it comes with a different dynamic. You have to call CalOSHA on top of recording it because it is a serious illness. See? And so what is this? FedOSHA issues revised enforcement guidance. It's just the same. They're just strengthening, their enforcement in the healthcare industry, meaning we are the focus. And factors FedOSHA considers for work-relatedness. Of course, for work-relatedness, you cannot just easily say, oh, it's community acquired or it's work-related. So if it's work-related, my friends, you don't just say work-related. See? You go to the motion. You must have an evidence to show that it's work-related, that it was contracted at work. And you must conduct an investigation that is reasonable. Remember privacy. When you do your investigation to find out whether it's work-related, you don't call family members or their friends. Hey, did you have any contact with you for the last 14 days? All of this, you don't do that. Privacy, my friends, privacy. Just limit, confine your investigation in the facility. And you don't talk. Never tell employees, including all of you. Do not say, oh, you know what? Mr. So-and-so is COVID positive. They have the right of privacy. You know what is HIPAA? HIPAA is not only for residents. HIPAA is also for employees. You could be even fired or terminated. Don't you understand that? The only one who should know or could know and can discuss are the following: the administrator, the infection preventionist, or perhaps the DSD as part of their perhaps contact tracing. Other than that, you're not going to talk. You know what? He was tested positive yet because of the stigma. We don't want them to become a pariah where everyone would like to avoid. So, always remember that. See, I will not go into this one by one. The reasonableness, already discussed that. The evidence available to the employer. And it must be contracted at work. You have to conduct an investigation. And then factors that are supporting not work-related, we already know that. What if it's community acquired, perhaps someone at home, members of the household, or perhaps contracted in his primary employer because his employment with Los Balos is only part-time. So all of these are factored in. I already discussed this with you regarding reporting the injury to CalOSHA when there is death or serious injury illness. And then I'm already done actually. I don't need to discuss this anymore. What does it mean is that according to CalOSHA, all of the guidance of CDC, of the Department of Public Health, is part of the OSHA. So in other words, your contact tracing, your quarantine, your isolation, your cohorting, your 14 days quarantine, your 10 days and 3 days, the test-based, the non-test-based, the symptoms-based, all of these are included in OSHA. So when they come into the building, they can also ask you those questions. And I guess that's it. I am done. Right? And so I will not entertain any questions. Not that I'm avoiding. I would love to answer your questions, but it's already past 12. I'm already hungry. I'm sure all of you are hungry. You know what, my friends? If I look tired, because I am really very tired. For the last 3 days, I've been traveling to a facility. And yes, The driving takes me 4 hours. So if you need, you can email me your questions, or perhaps in a different forum or setting, we can do it. So Lan, are you in?
Yes.
So everyone, you can already unmute them if they want to say something. Unmute? Anyone?
Thank you, Joey.
Yeah, Josie?
Thank you.
Daddy. Thank you.
Yeah, you're very much welcome. I hope all of you were not sleepy, you were listening.
No, we were
No, it
listening.
was informative.
Yeah,
Yes.
always. I only share informative information that would help our employers and of course our employees, because this is for the benefit of our employees. So thank you so much, and we'll see in the next forum what type of seminar that I'm going to conduct. Thank you so much for your
Thank
time,
you, Joey.
and that's it. Thank you. Bye.
Okay.
Bye.
Mary Lou, Cindy says thank you.
Thank you.